My name is Vanessa Thompson. I'm a general internist and primary care physician. So far in this series, we've discussed what dementia is. We talked about how to normalize screening. We've shared toolkits for diagnosing. We've covered how to adapt your assessments for different types of patients, and we've outlined how to create a care plan. Now we're going to discuss ways to disclose a diagnosis to your patient. Here are a few general principles about disclosure. Try to plan for a longer visit, at least 20 to 30 minutes, and focus your visit on just this one topic. Invite others to be part of the visit because people with dementia often don't retain all the information you provide. Say hello to and include everyone in the room. You might say something like, "I'm so glad you came today. Remember, we need to support caregivers too." Speak plainly and use language that resembles theirs. For example, memory loss or brain fog instead of mild cognitive impairment. In other words, avoid jargon. Use pauses and make space for questions. So to start the conversation, it often helps to ask the patient what they understand so far. You might say, "We've been doing an evaluation to understand why you have been having more trouble remembering medication changes. What do you know about what we've been working on?" You'll want to review what was done as part of the workup thus far. For example, you might say, "Let me review the test results with you and what each of them is telling us. The blood tests tell us there's nothing wrong with your thyroid or your vitamin levels, and no infectious disease is causing your symptoms. The brain scan showed that there's nothing structurally wrong with your brain." Next, clearly state the diagnosis. You may be mostly delivering a diagnosis about the syndrome without knowing yet what the underlying disease is, and that's okay. It is still helpful for patients and families to hear the word. You might say, "Putting all this information together, you have what we call dementia, which is when people lose some of their thinking abilities to the point that it affects their day-to-day life." If you're in the middle of your workup, explain that. You might say, "The most likely diagnosis is a form of dementia, but we will monitor you closely over time, and that will help us a lot." Or you could say, "We will refer you for further testing and discuss those results after that visit." When you sense the patient and family are ready to hear more, it's time to offer some hope and a lot of support. You can say, "There's a lot we can do to make sure your brain is as healthy as possible for as long as possible. For your current symptoms and day-to-day needs, we can support you." Just as in any good primary care interaction, be sure to ask, "What questions do you have?" Remind them that you will continue to be here to answer questions and to partner with them as they manage and live with the diagnosis of dementia. To review, you'll want to deliver a diagnosis in a way that centers the patient, instills a sense of hope, reminds them of their supports, and lays out clear next steps. As you do this more and more, you'll find your own way to communicate with patients that's comfortable for you. For a link to more resources on this topic, please visit the diagnosis section of our website.